Today's webinar has been brought to you by Services for Independent Living and the Cleveland Department of Health. My name is India Jones, and I will be your webinar facilitator for today. And I am also the Community Services Manager here at Services for Independent Living. Just a few housekeeping rules. All participants will be muted during the webinar. Please type your questions in the question box. We will attempt to answer them at the end. A recording of this webinar will be available on our website at www.sil-ohio.org. In the handout section, there is a little handout that you guys can download if you would like that has additional resources about COVID-19 vaccinations. Also, if you feel that you need assistance with anything in relation to COVID-19 vaccinations, please select yes on that question that will be on the webinar on the satisfaction survey that will pop up immediately after this webinar. If you would like 1 CEU credit for attendance for today, also make sure that you select yes on that particular question, okay? So today we have a very, very great speaker. We're really happy to have her. Her name is Lynn H. Milner, MD. She is a native here in Cleveland, and she has practiced for over 20 years and is currently the medical director for the Cleveland Department of Public Health and the associate director for Metro Health Express Care. She attended Andrews School and is a graduate of Smith's College and Case Western Reserve School of Medicine. She currently serves on the Applewood Board of Directors. Since the COVID-19 outbreak, she has helped staff over at Metro Health's COVID hotline and has personally taken over several calls since it began last March. She has participated in frequent Zoom webinars, presentations on current COVID testing and information, CDC recommendations, outbreak management, and vaccine updates. And now we're very happy to have her here with us today. So, everybody, I want to welcome Lynn Milner. Lynn, you have the floor, and thank you so much for agreeing to talk with us today for a little bit.
Thank you. So I just want to make sure you can see me and you can hear me. Is that correct?
Yep, I can see you.
Okay, so I'm going to turn my volume down a little bit because I don't want it to mute. So thank you very much for the opportunity. Good morning to everyone, and I so appreciate you taking time out of your schedule today to hear what we still consider to be very valuable information. So I want to start out a little bit talking about COVID and where we are with COVID. So as you know, COVID infection is caused by a SARS-CoV-2 respiratory virus that's actually been around for a number of years, but this virus is obviously unique, and we first started seeing cases here in this country as early as probably last February and early March. And initially, the symptoms that first came to people's attention were cough, fever, and shortness of breath. And at that time, we knew very little about how the virus was spread and what symptoms were important. As that time went on, the list of symptoms that became important expanded to include fever, again, diarrhea, vomiting, belly pain, the change in the sense of smell and taste. We first heard about from our friends across the oceans, and it finally trickled over here. And now what we know about COVID, as much as we do know that people have what we call long-term symptoms. So why is it important to know about the symptoms? What we know about COVID more than anything is that it affects the most vulnerable populations the worst. So those are people with long-term chronic conditions. Those are elderly, are very young, those that are immunocompromised, and those that can't get vaccinations, partly because they're too young, but there's very few medical conditions that prevent the vaccine. The studies about getting the vaccines, while they seemed to have been rushed, were actually not. We try to explain it like we were waiting for the opportunity to decode a virus to be able to use that vaccine. But the research around the vaccine has been in place since the 1960s. We just needed to break the right code. So the vaccines in this country have been available since the beginning of probably January, late December of last year. They've been given to millions, and what we know about the vaccines to date, that they are safe, they are effective in preventing severe cases of COVID among the well and the not so well. They prevent, hopefully, severe infection that causes you to be in the hospital, heaven forbid, intubated or fatal cases. So we've always, at least as you know, initially encouraged those that were at the extremes. We wanted our elderly to be vaccinated first, and then we changed to include patients that had chronic conditions and developmental and congenital disabilities, because we know those are the patients that are most affected. So if you followed surges, we've had several surges of COVID. There were a number last year, and probably the last surge up until the most recent surge was maybe December, maybe spring of this year. And now, very sad to say, for a lot of reasons, one being that we haven't been able to vaccinate as many as we would like, and there are all kinds of challenges. In the beginning, we had a lot of people that wanted the vaccine and didn't have enough vaccine, and then we went to the other extreme where we had a lot of vaccine and we couldn't get people to get the vaccine. Now we're still faced with, we probably have a reasonable supply of vaccine, but there are still people that are challenged with able to get the vaccine. So if you're homebound or you're immobile or you don't have resources, that can get you to a vaccine or get a vaccine to you, we're still working through those challenges. So very important that you use at every opportunity resources that can assist you with getting a vaccine. So even if you don't have a major hospital provider or a primary care provider that can assist you with that. I understand too that not everybody's internet savvy or has internet in the house, and I'm sure there are a lot of people on this phone that use flip phones that aren't smartphones, so that may be a challenge as well. But there are community resources and several resources that are available to you to assist with getting the vaccine. New things that have become more apparent. The surge now is based on a new Delta variant, and what we know about this variant is, unlike former versions of COVID, this one is highly infective, highly transmissible. So it's very much possible to be able to spread the virus without knowing that you have the virus. The downside in the state of Ohio, at least if I do glass half full, at least half of our state has had at least one vaccine and half has been fully vaccinated. That means that there's a whole lot of folk out there who haven't been vaccinated for a number of reasons. The myths and misinformation is real. So we encourage you, as you weigh your vaccine decisions and choices, that you get appropriate information from a trusted source. It's easy for the people that pick why to get the vaccine. The why not is very complicated. And we understand that a lot of people make decisions based on misinformation or rumors or, information from Aunt Sadie or Cousin Ben, and that's not always the most reliable source. But there are, information out there that is reliable that should aid your decision. Have conversations about your why not so that you can get that information. One thing I want to clear up is that, yes, the vaccines right now were approved for emergency use authorization, which means in times of a pandemic, you can do the appropriate studies to get the vaccine out and be able to use it. And yes, they are still working on getting the vaccine to be FDA approved. FDA approval really, in essence, is a longer time and period of study from once they start using the vaccine to make sure that it remains safe and effective and available to all. There is no cost to get the vaccine. It is paid for by the federal government. There are some places that may charge an administrative fee to give the vaccine, but it is free for all. So in the beginning, we did it at hospitals, and now we do it at drugstores and pharmacies. We've done it at churches and gas stations and Jiffy Lubes. We're trying to work through having like mobile vaccination. I make the joke, but I don't mean it lightly. If we could deliver vaccines like we have Amazon packages delivered, perhaps we wouldn't be faced with many of the challenges that we have today. So very important that all healthcare providers, this is a public health issue. As we know, the variant is large and highly transmissible. If you choose not to get vaccinated, you'll still need to do the same precautions we've always recommended, and that is masking, trying to avoid large social gatherings. And that's, a relative term. So my large social gathering might be a Browns game, but for some it might be the 4th of July, Labor Day's coming up, might be going to a fair or a large book club or going to a movie theater. But those places aren't becoming as trustworthy as they had before the most recent surge. Reason why we have different variants of viruses, just to simplify this for people, they're like, well, I've got a vaccine, I'm protected against the new variant for the most part. But you have to think of COVID like we do. COVID is a very smart organism, and once they know that they're being attacked, they will find a way to change what they do and how they transmit themselves so that they can transmit and infect as many people as possible. So very important, if you choose not to be vaccinated for whatever reason, that you do continue to mask, you continue to distance, and you continue to avoid those situations that make it, more likely for you to get COVID. We've not seen as many breakthrough infections, and those are those infections that people that have been vaccinated will turn up to be positive. But what we can say, if it is a breakthrough infection, it's a much milder form of disease. And even though our hospitalizations have gone up recently, they haven't gone up to the point where we're running out of ICU beds and have to intubate people. So you might get admitted to the hospital, but you're a lot less likely to be sicker than you were, say, 6 months ago. There still is no treatment for COVID. Long haul symptoms are real, so some people will continue to have shortness of breath, feel a little weak, sometimes the brain fog, and unfortunately for those of you who love to cook and love to eat, the sense of smell and taste sometimes takes a little bit longer to come back. But looking for this group, what's important to remember that there are several resources available to you to assist you with getting vaccine information and getting a vaccine. So certainly if you're internet savvy, and I know we push out a lot of websites, but they're a valuable source of information. So the CDC, if you can tackle that one, has great resources for symptoms, vaccine availability, and safety. But here in our neighborhood, there's the Cuyahoga Department of Public Health and the Cleveland Department of Public Health with several resources for both the well population and for those with disabilities. Also, the Center for the Aged, you can reach on the Ohio Department of Health, are great resources. So what we want more than anything for you to take away is the vaccines are effective. They've been given to millions. They save lives. And the last thing we want for anybody that's compromised or has a disability to get COVID on top of their chronic health condition and their disability, because they don't play well together. And we want to prevent you from getting severe disease that we can prevent with a vaccine. I think that's a good overall view of where we are now. I just do want to leave that the numbers are continuing to go up. So it's really important that we took our foot off the gas, and now we need to put our foot back on the gas now to stop the spread. If everybody can't get vaccinated, we'll still have to do the things that we have to do. One question that I always get is, do we think that we will shut down again or go back to where you can't do things? I don't think that's likely to happen, but there may be some, steps we have to take in order to stop the spread and slow the spread down. So I think I'll stop there and
All right.
turn it back to the chair, and we'll be open to questions in shortly.
All right. Thank you so much, Dr. Milner. And I think people just really need to hear, from not just their neighbor or their family member about the importance of, still taking this situation seriously. So the next thing that I would like to do is to introduce Services for Independent Living's Director, Shannon Moniak. She's going to talk to you guys about the services that we actually have here in regards to COVID-19 relations. All right, Shannon, you have the floor.
All right, here we go. So I don't see myself on the screen, so I'm not going to lie. I can't tell if anyone can see me. If you can, great. If not, it's nobody's loss.
Yes, we can see you.
Oh, okay, perfect. So thank you, everybody, for attending the webinar. Thank you, Doctor, for getting on here and speaking. Again, it's up to everybody, whether it's personal choice, religious choice, what have you, to get the vaccination. We're merely here to support anybody that chooses to do so in certain means. And we were thankful enough to get some funding to help those with the vaccination process. So what that means is how can SIL assist you with the COVID vaccines? The first one is, and I don't know what order I'm in, so India, can you fly me my first one? There it is. So educating about the importance of receiving vaccination. So that's what we're doing here, right? So we contacted the doctor. We said, can you jump on and give everybody who we serve and professionals and other entities just the facts. There's a lot of myths out there. There's a lot of exaggerations. I read about them every day. So really it's educating everybody on the importance of getting the vaccination should you choose so. Identifying people unable to independently travel to a vaccination site. We as a Center for Independent Living are able to be like a buddy, right? We can be a chaperone for somebody that maybe is really anxious about traveling to a site and getting their vaccination. We have staff available, of course, we'll do our best to social distance and mask up to help somebody in the process. A lot of people take family members or friends or what have you, and some people don't have that. So we as a center are here to go with somebody in the event that they don't have anybody to go with and they would like somebody to be there with them through the process. Help scheduling a vaccination appointment. A lot of people don't have the ability to have the internet or a computer or a tablet. There are toll-free numbers that have recently been launched that can assist in scheduling somebody's vaccination appointment. We are also here to help. Anybody can call our main number and say, I would like help getting my vaccination appointment scheduled. Through a couple easy answers, where are you calling from? We can type in the zip code and find out where's the closest site or what's the preferable site. At least here in the Cleveland area, we have a number of hospitals that do it, as well as like the drug marts and the CVSs. So for everybody, wherever anyone is comfortable, we can look that up and then get it scheduled for somebody. Arranging or providing accessible transportation. This is a big one. So we're hearing for a while that some individuals that would like to get the vaccination can't get it due to transportation issues, whether that's because they live in a rural setting and the busing or the public transportation doesn't come out their way or doesn't cross county lines. Here in the Northeast, we have that barrier. But then also maybe they don't have accessible transportation, so we can assist with that. I'm actually working with a local transportation agency to provide the rides because they have accessible vehicles, they have bigger vehicles to take more than one person. Let's say, there's 3 people on the same street that need to get their shot done. So we're working with local transportation agencies to provide those rides. We can also schedule Lyft and Uber, and it's at the expense of us. It's at no cost to the person that does call. So in the event that an individual does call, needs their vaccination scheduled, we can schedule it, and then we can provide the ride. We as SIL staff members cannot be the actual transporters, but we are there to help schedule the rides for the folks that need them. Providing companion and personal support kind of goes with the one I said before, but again, if somebody's having some anxiety about it, or maybe doesn't know how to navigate where they're going. For example, up here in Cleveland, we do have Fairview Hospital that does vaccination shots. It's a pretty large facility. I will say that they are very clear in the route that one would take to get to where you need to have your shot administered. But again, sometimes it's just navigating through a building or knowing exactly where to go. So we're here to help. Absolutely. We want to make it an easy process and help those through it, because it is a little anxiety ridden of a thing to do. And then reminding people of their second vaccination appointment if needed. In the event that we assist somebody, and we not chaperone, that we kind of like are a buddy system to somebody that goes and their second shot is scheduled at the time of their first, we can absolutely have a reminder call done to the individual so they remember that you have a shot in, whether it's 2 weeks, 3 weeks, or 4 weeks from your first one. Even if it's just a little card that states when it is. And then again, we would be able to set up the transportation for that second one.
All right, thank you so much, Shannon, for that great information. We are more than happy to help the community to and from their appointments. So please, if you know someone or if you are in need, feel free to contact us. We're going to move on to a few questions that we do have. The first question, Dr. Milner, was I have a 16-year-old daughter who has a disability, but she is homebound. Does she still need to get vaccinated?
That's actually a great question, and I would encourage her to get vaccinated. Even if she's homebound, if there are people that go outside of the home that may interact with others, you can always bring that back to your home. A lot of people are very surprised, sometimes incidentally, that they got tested for COVID because they were having a procedure done, or they're like, but I haven't been anywhere, I haven't been around anybody. Yeah, COVID is one of those ones that it's just, it's very good at making sure it reaches as many people as possible. So it may not be the encounter that you think it is. And sometimes we do have to go out. Somebody has to drop off groceries, or you got to pick up a prescription. So yeah, even the homebound, right, are vulnerable, especially if there are other people that go in and out of the home. So it's important that you protect those while you're out, but also protect those that are still left at home and can't get out.
All right, thank you for that. The next question, I have been told that the Moderna vaccination is more toxic. Is this true?
It isn't true, and I don't know how that information got started. I don't think we've ever looked at them with levels of toxicity. We know that once you get it, you can have an immune response that makes you feel like you got the flu, but that's your immune system working. We call that a robust response. But I don't believe that we've characterized any of them as more toxic or more side effect promoting than others. I mean, if you have vaccinated same people in the same house, everybody kind of has a different response to it. And some of them are like, I felt nothing at all. And then there are others that feel like, yikes, this is the worst thing possible. So one isn't any more toxic than the other.
Right. Okay. Thank you. And then the last question that I have is, what is a better way for me to try to encourage my employees who I know personally may be at higher risk for severe illnesses to take part in getting vaccinated?
Well, what I encourage people mostly is to look at it as not just a private health issue, but a public health issue. If you're around other people, it's important that you protect yourself from other people and you protect other people from you. And especially even if, you're an employee and then you think, what's the worst that could happen? A few of my coworkers get sick, but we want to protect your family at home and everyone you come in contact with. So the second part to that question is, no, we have not made vaccines mandated for employers yet, but I suspect that once they get FDA approved, that will actually be the next step, is that, for places where you work, you may be required to get a vaccine, much like some organizations do for the flu. But it's really important. And if employees are questioning, should I get it? Well, why shouldn't I get it? Please encourage them to have, trusted informations and trusted providers they can have that conversation with. I don't treat it like it's a debate or an argument, but if you have questions, we want to answer those questions for you.
All right. And I'm sorry, just one more question. Is it true that individuals that are in long-term care homes are more at risk and this has still not been fixed?
Yes, they are more at risk, actually for two reasons. So a lot of people in those facilities may have chronic health conditions. So that's, already strike number one. They may be elderly, that's strike number two. And then the staff that goes in and out of those homes, if they're not vaccinated, right, or their family members aren't vaccinated, then they are at much higher risk to be able to bring that back into the home. As you remember back, there was a time you could even have your family visit at long-term care facilities. And I sincerely hope we don't have to go back to that. But, the people that are in those facilities are a captive audience, right? So they rely on the people that take care of them to be vaccinated. And as we know, not all of them are.
Right. Okay, so I just wanted everybody to be able to view Dr. Milner's information. If you have a personal question that you do not want to ask on here, please feel free to email her. Also, our director, Shannon Monyak's information is up, just in case you want more information about the services that we are going to provide and are able to provide for you to get vaccinated. I just want everybody to remember that COVID-19 vaccines do remain safe and effective. I know that we're hearing a lot of different riffraff, and we have our cousins or friends saying different information, but remember, if they are not a professional, that is just speculation. COVID-19 vaccinations can help prevent severe illnesses, hospitalization, and death. And yes, we are hearing cases about individuals who are vaccinated, supposedly getting reinfected, but a lot of people may be partially vaccinated, or we can't really go by hearsay. So let's all come together, try to spread the word about the services that we are providing here as services for independent living if anyone is in need of getting vaccinated, and stay positive while we're still going through, and I have to say, this world crisis. So I want to thank you, Dr. Milner, for being able to come on and speak with our audience today. And thank you, Shannon, for sending out the information that we currently have to help them with getting vaccinated. If anyone needs assistance, remember there will be a satisfaction survey that will pop up directly after the webinar. Please answer that question, and we will have one of our staff members get in contact with you right away. If you want 1 CEU credit for attendance, and this is only for social workers and social worker assistants, please select yes on that particular question. So everyone, please stay safe. Thank you, Dr. Milner.
Thank you, Shannon.
And everyone, please stay safe and have a great day.
Thank you
Bye-bye.
again.
Thanks, everybody.
Stay safe. Thanks. Bye-bye.